Over 7 million Americans have undiagnosed diabetes that is silently damaging their organs right now. These individuals continue normal daily activities while elevated blood sugar gradually harms their kidneys, nerves, eyes, and heart, often without any obvious symptoms. What many people do not realize is that the skin often displays visible warning signs months or even years before standard diagnostic tests detect diabetes. The body's largest organ essentially sounds an early alarm that something is wrong with blood sugar metabolism. Medical research has identified 7 critical skin changes strongly linked to developing diabetes. These include specific discolorations, textural changes, healing abnormalities, and particular types of growths that signal metabolic dysfunction. These visible changes can appear up to 5 years before standard blood tests show abnormal results. This detection window provides a critical opportunity for intervention before permanent damage occurs. Pay special attention to sign number 3, shin spots that frequently get misattributed to simple bruising or age spots. This specific change appears in over half of diabetics, but remains one of the most overlooked diagnostic clues. Recognizing these signs could lead to early intervention and potentially prevent serious complications such as nerve damage, vision loss, and cardiovascular disease. The simple skin check outlined in this video might quite literally save your life. Sign number 1, acanthosis nigricans, dark velvety patches. Acanthosis nigricans presents as dark velvety patches of skin with a thickened, textured appearance. This distinctive condition develops when insulin resistance causes skin cells to reproduce too rapidly. As insulin levels rise in the bloodstream, the excess insulin binds to insulin-like growth factor receptors on skin cells, stimulating abnormal growth and pigment production. These patches typically appear dark brown to black with a texture resembling velvet or very fine sandpaper. Many patients initially mistake it for poor hygiene, describing it as a dirty neck that does not wash away. Unlike normal skin darkening from sun exposure, acanthosis nigricans feels distinctly different, thickened and textured rather than smooth. Common locations include skin folds where friction occurs, the back and sides of the neck, armpits, groin area, and under the breasts. Research from the American Diabetes Association shows this condition is present in up to 98% of people later diagnosed with type 2 diabetes, making it one of the most reliable early warning signs. Maria from Texas discovered her diabetes through this sign. After noticing darkening around her neck that no amount of scrubbing would remove, a dermatologist recognized acanthosis nigricans and ordered diabetes testing, revealing significantly elevated blood sugar levels despite Maria experiencing no other symptoms. Those at highest risk include individuals with darker skin tones, obesity, polycystic ovary syndrome, PCOS, and family history of diabetes. The condition appears more prominently in Hispanic, African American, and Native American populations. To check for this sign at home, examine your neck in good lighting using a handheld mirror. Look for symmetrical darkening that feels velvety to the touch, particularly at the nape and sides of your neck. While you are examining your neck, you might notice our second warning sign. Sign number 2, skin tags, multiple small growths. Skin tags develop when insulin resistance triggers accelerated and abnormal skin cell growth. The same mechanism causing acanthosis nigricans also promotes these small flesh-colored growths. Scientific research indicates that elevated insulin acts as a growth factor, stimulating excessive cell proliferation in susceptible skin areas. These growths appear as soft, flesh-colored or slightly darker papules hanging from the skin on a thin stalk, typically ranging from 1 to 5 mm in size. Unlike warts, skin tags have a smooth texture and cause no pain or discomfort. They move freely when touched and may become irritated when clothing or jewelry rubs against them. Common locations include the sides and back of the neck, eyelids, armpits, under breasts, and groin folds, areas subject to frequent friction. Research published in the European Journal of Dermatology demonstrates a 65% correlation between multiple skin tags and impaired glucose tolerance. While isolated skin tags are common in the general population, the presence of numerous tags, especially when they develop rapidly, strongly suggests metabolic disturbance. Studies show individuals with more than 5 skin tags have significantly higher risk of undiagnosed diabetes. Robert from Chicago experienced the rapid development of over a dozen skin tags around his neck and underarms within 6 months. This unusual growth pattern prompted his dermatologist to suggest diabetes screening, which revealed pre-diabetic blood sugar levels that had not yet appeared on routine testing. Middle-aged adults between 40 to 60 years old face highest risk, particularly those with family history of diabetes, obesity, or metabolic syndrome. Women during hormonal transitions also experience increased susceptibility. To check for this sign at home, use a handheld mirror in good lighting to examine areas where skin rubs against skin. Count any small, soft growths on thin stalks, paying particular attention if you notice increasing numbers developing over months. Our third sign affects the lower legs and is often mistaken for age spots. Sign number 3, diabetic dermopathy, shin spots. Diabetic dermopathy manifests as small, round or oval, light brown to reddish patches primarily appearing on the shins. These distinctive lesions develop due to microvascular changes, damage to the tiny blood vessels that supply the skin. As elevated blood sugar damages these vessels, localized areas receive reduced blood flow, resulting in these characteristic spots. The spots typically measure 0.5 to 1 cm in diameter and appear as slightly scaly, atrophic depressions that do not hurt, itch, or cause any physical sensation. Their color ranges from light brown to dark reddish brown, often starting as slightly raised scaly areas that eventually flatten and leave a depression or indentation. While primarily appearing on the front surface of the lower legs, shins, these spots occasionally develop on the forearms, thighs, or trunk. Research published in the International Journal of Dermatology indicates diabetic dermopathy is present in up to 55% of diabetes patients, making it the most common cutaneous manifestation of diabetes. Unlike regular age spots, diabetic dermopathy spots often appear suddenly in clusters and show distinct depression or atrophy. Unlike bruises, they persist indefinitely without the typical color changes associated with bruise healing. James from Minnesota had dismissed the spots on his shins for nearly 4 years, attributing them to minor injuries from yard work. Only after developing other symptoms did testing reveal his blood sugar had been elevated throughout that period, with the shin spot serving as the earliest visible warning sign. Long-term undiagnosed diabetes creates highest risk, with men affected more frequently than women. The condition appears more commonly after age 50. To check for this sign at home, examine your shins in good lighting, looking for clusters of small, round, brownish spots that do not wash off or fade over time. The fourth sign involves a frustrating skin condition that is resistant to normal treatments. Sign number 4, persistent fungal infections. Persistent fungal infections thrive when elevated blood sugar creates an ideal environment for fungal overgrowth. Fungi naturally feed on sugar, and when blood glucose levels rise even slightly, these organisms find extra nutrients in sweat, urine, and other body fluids, essentially creating a perfect growth medium on the skin surface. These infections typically appear as red, itchy rashes with clearly defined borders. A key identifying feature is the presence of satellite lesions, small spots separated from the main infected area. The affected skin may appear moist, develop a white or yellow discharge, and cause significant itching or burning sensations. Common locations include warm, moist areas where skin touches skin, between toes, athlete's foot, groin area, jock itch, under breasts, in armpit folds, and around nail beds. Research published in the Journal of Clinical Endocrinology shows recurrent fungal infections precede diabetes diagnosis in approximately 55% of cases. Besides sugar-rich body fluids feeding the fungi, diabetes also impairs immune function, specifically reducing white blood cell effectiveness against fungal organisms. This creates a double vulnerability: more fungal food plus weakened defenses. The hallmark difference between diabetic and non-diabetic fungal infections is their persistence and treatment resistance. While typical infections resolve with standard antifungal treatments, those associated with blood sugar issues often return repeatedly or never fully clear despite appropriate medication. Susan from Florida experienced recurring vaginal yeast infections that remained resistant to treatment for nearly a year before her doctor suggested diabetes testing, which revealed elevated blood glucose levels that had not yet reached diagnostic thresholds. Women face higher risk due to anatomical factors, as do those using antibiotics, which kill beneficial bacteria, and people living in humid environments. To check for this sign at home, examine skin folds for persistent red, itchy rashes that do not respond to standard over-the-counter treatments within 2 weeks. Our fifth sign involves how your skin heals after injury. Sign number 5, slow healing wounds. Slow healing wounds develop when elevated blood sugar significantly impairs the body's natural healing processes. 3 key mechanisms cause this disruption: reduced blood flow to tissues, impaired white blood cell function, and nerve damage that delays injury detection. Together, these create wounds that remain open far longer than normal. These slow healing wounds appear as persistent openings in the skin that remain red, swollen, or draining beyond the expected healing time frame. Normal cuts or scrapes should show significant healing within 3 to 5 days and close completely within 2 to 3 weeks. Diabetic wounds often show minimal improvement even after weeks or months. Lower extremities, particularly feet and ankles, show the most pronounced healing problems due to naturally reduced circulation in these areas. Research published in Diabetes Care demonstrates a direct correlation between healing time and blood glucose levels. For every 1% rise in A1C, wound healing time increases by approximately 30%. David from Pennsylvania discovered his diabetes after a minor cut on his foot remained open and inflamed for over 6 weeks despite proper care. Testing revealed his blood glucose had been elevated for months, with the delayed healing serving as the first obvious symptom. Slow healing occurs because elevated blood sugar causes small blood vessels to narrow, reducing oxygen and nutrient delivery to wound sites. Additionally, white blood cells function less effectively in high glucose environments, impairing their ability to fight infection and coordinate repair processes. Those at highest risk include older adults, smokers, and people with peripheral vascular disease or neuropathy. Even minor elevations in blood sugar can significantly impact healing capacity. To check for this sign at home, monitor how quickly minor cuts or scrapes heal. If wounds remain open, red, or swollen beyond 2 weeks, this warrants medical attention. The sixth sign involves a sudden change in skin sensation that many mistake for simple dryness. Sign number 6, dry, itchy skin. Diabetes causes dry, itchy skin through multiple mechanisms that disrupt the skin's natural moisture balance. Elevated blood sugar affects sweat gland function, reducing their ability to provide natural hydration. Additionally, diabetes damages the nerves that control oil and sweat glands, further compromising skin moisture. This condition presents as persistently dry, flaky skin that remains parched despite regular moisturizing. The itching often feels intense and may occur without any visible rash or redness. Unlike normal dry skin that improves with moisturizers, diabetic xerosis, medical term for pathological dry skin, proves stubbornly resistant to standard treatments. Common locations include the extremities, particularly lower legs, feet, and hands, though many experience generalized whole-body dryness and itching. Research published in the Archives of Dermatology found that unexplained pruritus, itching, correlates with undiagnosed diabetes in up to 49% of cases when no other cause can be identified. 3 factors contribute to this condition: dehydration from increased urination as the body attempts to eliminate excess sugar, nerve dysfunction affecting oil and sweat gland regulation, and reduced sweat gland function due to microvascular damage. Patricia from Michigan experienced sudden onset severe itching without any visible rash. Despite trying numerous moisturizers and antihistamines over several months, the itching persisted until diabetes testing revealed elevated blood glucose levels. Once her blood sugar normalized, the itching resolved significantly. Those at highest risk include individuals experiencing winter months when ambient humidity drops, older adults with naturally thinner skin, and those with early neuropathy. The itching often intensifies at night, disrupting sleep. To check for this sign at home, notice if skin remains persistently dry despite regular moisturizing, particularly if accompanied by unexplained itching without visible rash, or if the itching seems disproportionate to any visible skin changes. Our final sign is the most serious and requires immediate attention if observed. Sign number 7. Yellow, reddish, or brown patches. Necrobiosis lipoidica. Necrobiosis lipoidica represents the most serious skin manifestation of diabetes, occurring when the disease causes collagen degeneration and fat tissue inflammation. This condition begins as raised reddish-brown spots that gradually expand and develop distinctive characteristics unlike any normal skin condition. In its developed form, these patches exhibit a yellow or reddish-brown center with a shiny, waxy, thin appearance. So thin that blood vessels become clearly visible beneath the surface. The patches often have a raised, firm, violaceous, purplish-red border. As the condition progresses, the affected skin becomes increasingly atrophic, thin, and vulnerable to injury. While primarily appearing on the shins, these patches occasionally develop on the hands, forearms, or trunk. Research published in the British Journal of Dermatology indicates this condition is relatively rare, affecting approximately 0.3% of diabetic patients, but carries a 90% or higher correlation with diabetes when present. This condition develops through an inflammatory response to vascular changes and glycated proteins, proteins damaged by sugar molecules. As the inflammation progresses, it destroys normal fat tissue and collagen, creating the characteristic appearance. Janet from Ohio discovered her type 1 diabetes after a dermatologist recognized the early signs of necrobiosis lipoidica on her shins and ordered comprehensive diabetes testing, despite her having no other obvious symptoms at the time. Those with type 1 diabetes face higher risk than those with type 2, and women develop the condition 3 times more frequently than men. The condition often appears between ages 20 to 40. To check for this sign at home, examine your shins in good lighting, looking for unusual yellowish or reddish-brown patches with a shiny appearance, especially those where blood vessels are unusually visible through the skin. Now that you are familiar with these 7 signs, let us discuss when to seek medical attention, when to see a doctor. Seek medical attention promptly if you discover any of these 7 skin signs, particularly if you have diabetes risk factors such as family history, excess weight, or sedentary lifestyle. Request both fasting glucose and A1C testing specifically, as some early cases can be missed with standard glucose testing alone. Certain combinations warrant more urgent evaluation. If you notice slow healing wounds alongside persistent infections or acanthosis nigricans with multiple skin tags, schedule an appointment within 1 week, as these combinations strongly indicate active metabolic dysfunction. When speaking with healthcare providers, specifically mention your skin concerns as potential diabetes signs rather than isolated dermatological issues. Take clear photos of the affected areas before your appointment, as some conditions may vary in appearance day to day. For accurate evaluation, see both a dermatologist and primary care provider if possible, as each brings specialized expertise to different aspects of diagnosis. Let us now explore how to properly check your skin for these warning signs. How to check your skin. Conduct a monthly skin check using these simple steps. First, gather essential tools: a full-length mirror, handheld mirror, and bright lighting. Begin by examining your neck, armpits, and other skin folds where acanthosis nigricans and skin tags commonly appear. Next, check your shins for brown spots or unusual patches. Examine all skin folds for signs of fungal infection, redness, itching, or white residue. Pay special attention to any wounds or cuts, monitoring healing progress. Note areas of persistent dryness or itching. Document concerning findings with smartphone photos, noting location and date for comparison over time. Perform this check regularly, especially if you have diabetes risk factors. Let us wrap up with important steps to take right now. Conclusion: these 7 skin signs offer early warning of diabetes, often appearing years before standard diagnosis. Perform your first skin check today, photographing any concerning findings. If you discover these signs, seek testing promptly. Early intervention can prevent serious complications and possibly reverse prediabetes before it progresses to full diabetes. Subscribe for more early detection guidance.